We are about to show you exactly what laser liposuction looks like. We have exclusive video of the procedure and some interesting before and after photos of patients that we'll show you in just a moment. Laser lipo is touted as the less invasive version of liposuction, and laser lipo is done under local anesthesia, and doctors say it only requires a couple of days of recovery time. That is video of Dr. Jennifer Jose performing laser lipo at Ultimate Solutions Medical Spa in Darien, and Dr. Jose specializes in internal medicine. Thanks for being here.
You're welcome.
This is a big part of your business now.
Yes, it is.
It's gotten more popular?
It became more popular because nobody wants to undergo general anesthesia anymore. So this is considered a localized anesthetic, and patients are wide awake. They can talk to us while I'm doing the procedure.
Can they feel it?
So they will not be able to feel it because it's localized anesthesia that I instill into the small incisions. And they're just talking. They're either listening to their iPod or they're just relaxing, and they have a chance to just go to sleep and not even listen to us. So
I want to show folks inside while you're doing it. It's a little graphic to someone who's never seen anything like this before, but less graphic than traditional lipo because it's not as violent a motion. Describe how this differs from traditional lipo.
Well, laser lipolysis is another term for SmartLipo. It actually is a very, very small fiber that they use, which is laser. It's different from traditional lipo because it's not under general anesthesia. And you go right through the skin where the fat layer is, and you simply melt the fat away without any invasiveness.
So you send the probe, which is a cannula, in.
Yes, yeah, very small cannula. It's such a small cannula that it's smaller than the size of a lead pencil. That's how tiny it is. Unlike the traditional lipo where the cannula is so big and bulky with a blade.
So you're taking out less fat and at a slower rate?
Actually, you're taking out all the fat in that layer of fat, and you're melting away.
What do you mean melting?
When the laser hits the fat layers of the fat layer, it actually, when I go in and out like a violin, I'm actually melting the fat right then and there. So
dissolving it?
It's dissolving it, but then when you suction it out, it's just like melted butter. So it's not like chunks of fat, unlike the traditional lipo. That's what they're taking out. But here, you're slowly suctioning it out where it's already melted like butter.
Most people go for the belly fat?
Absolutely. That's the most common area. And the guys is what they call the flank area or their love handles.
Ah, yes.
So, and that's
higher. There are various names for that kind of fat around the middle. All right, let's show folks some before and afters. They're pretty dramatic. Here's a before shot. What was her goal?
Her goal is to not lose pounds, but as you could see the fat, the belly, and around her sides, that is actually the flank area. But look at the results now. I mean, it's amazing.
That is amazing. Although the skin looks a little worn out from this.
And you know what? That comes, there's also an additional advantage to the SmartLipo. It actually tightens the skin. Okay. So this is only a month of after the photos.
It will smooth out?
Oh, totally. You're
That's
not going to see that.
Here's a gentleman in his undies.
Go
ahead. What did he have done?
And again, he wanted to get the upper and lower abdomen. And if you have a picture of the sides, look, I've taken out his love handles also. But look how flat his stomach is, and he's not holding his stomach in.
He's so pleased with the results. He bought different underwear.
That's it, totally.
When you do this, is there ever a case where the patient does feel it, and you have to stop what you're doing and put more
anesthesia?
Yeah, anesthesia.
Actually, you know what they're feeling is the pressure of my hand where I'm pressing against their belly.
So they get nervous?
Yeah, they get nervous. They don't know what it is, but it's actually my pressure of my hands and the probe going in and out, but they don't feel that. It's completely numb.
Now, you are interfering with the body system a little bit. Could it cause some kind of reaction?
Absolutely not, because it's so localized. It's not hitting any of the organs. It's directly under the skin, so it's the fat layer, so it's not even affecting any of the body systems. And an additional thing with the laser is that while you're melting the fat away, it's actually also sealing the blood vessels in the fat layers, so there's minimal bleeding to almost no bleeding.
I've heard that when you take fat from one area, fat cells will continue to grow in the areas nearby.
Once I get rid of the fat cells in the area that I am getting rid of, it's no longer going to be there. It's actually destroying the fat permanently. So it's not, if you gain more than 5 to 10 pounds of your previous weight before the surgery, it will go to other areas.
Okay, so you do run that risk of getting fat elsewhere if you gain weight.
That's correct.
A couple more before and afters, and then we got to go to a break. Here's another before. Let's look at the after. Did she go for the thighs or stomach? It's
very interesting because if you look at the back side of her picture, I actually had taken all the cellulite away from the sides of her thighs. I did the inner and outer thighs.
Okay.
If you have a picture of the back, see that?
There's the back.
This is impressive. Look at her cellulite on her buttocks, her inner and outer thighs. Look at the after shot. Completely gone.
And the shape has changed
It's
dramatically.
unbelievable.
We've got to run to a commercial. Thank you so much, Dr. Jennifer Jose. The not-so-great consequence that can come with time spent in the great outdoors. We're talking about bees, creepy crawlers, and avoiding tick-borne infections. Advice in less than 2 minutes right here on 12 on Health.